Hello, I'm Dr. Adriana Potter, and on today's video we're going to go over about TMJ dysfunction. TMJ stands for temporal mandibular joint, and a dysfunction of this joint, which is the jaw joint, it can create a lot of issues with chewing and also create a lot of headaches as well. Okay. A couple things that we need to consider about what is creating the jaw issue. It might be excessive movement or too much stress on the joint. Okay, with excessive movement, usually the rule of thumb about how wide should you open your mouth is about 2 finger width, your own fingers, and it shouldn't be more than that. And so whenever you are going to open your mouth to bite into something, it should not be bigger than 2 finger width. And for somebody who has hypermobility, if you try to open wider than that, it can create subluxation of this joint, and your joint can completely dislocate and locked up. Okay. Also, when you excessively open your jaw, the disc, which is a little like right here, a disc in the joint, it kind of slides forward and it stays there, and it doesn't allow you to close your jaw back. Okay. The next thing we're going to talk about is the fact of posture. People think that we, bug our kids about sit tall, don't slouch. And it's not just because we want them to have good posture, it's because the effects that has on the neck area. Okay. In relationship to the jaw, it is something very specific. People don't realize it, that they're creating a lot of jaw issues or even headache issues because of posture. So I'm going to turn myself sideways so you can see what bad posture can do to your jaw. Okay. The majority of the time we will see people doing the following with posture. They're going to be rounding their spine, so the shoulders immediately come forward and internally rotate, and your head comes this way. This is a very common bad posture that people do when they're on the computer. Okay, it's important to be nice and tall, shoulders retracted towards the back, and your neck over your trunk and your head over your neck. Okay, but how does that affect the jaw? Okay, right here I have a rubber band. Okay, so the rubber band corresponds to the muscles that we have underneath of the jaw muscles. Those are the jaw muscles underneath here, are the jaw openers. Okay, when you change your posture, okay, this is what happens. So here's me nice and tall, into, hopefully you can see the rubber band in there, and the muscles are just tensing up. When you bring your head forward, hopefully you can see that the space between the back of the rubber band here, it kind of creates a lot more tension into the rubber band. Okay, so I'm going to go a little bit closer so you can see it again, what it does. So this is nice and tall position. When you slouch and your head comes forward, that tension increases. Okay, so nice and tall, the tension decreases. Head forward, the tension increases. And when that tension increases into those muscles, it wants to pull your jaw open, because we are not watching the TV or the computer or the phone with our jaw like this. Right? We are actually closing our jaw, even though we're on the forehead, to overcome this tension that wants to open your jaw. So you're actually overworking the masseter, which the muscles right in here, and the temporalis muscle, which are the closing muscles of the jaw. Those are the muscles that should be acting only when you're chewing. But because the bad posture, those muscles underneath wanted to open your jaw with the bad posture, these muscles become overactive and they start having issues with pain into the jaw, headaches into the side of the head, and sometimes even here, because when you go into that forward position, you also have to have the muscles here on the back, right? They have to hold your head in that abnormal position, and the suboccipital muscles, which are the muscles right here underneath of your skull, they also create more tension in there. Okay, so first of all of everything is to pay attention to your posture and to be nice and tall and head over your shoulders. Okay, the monitor should be at eye level. Your reading material should be eye level, so it makes less likely for you to do this. So make sure that it's eye level and close to you. That way it will put you on the optimal position to be successful with good posture. Okay, so the second thing I want to talk about, it is how your muscles on the jaw are, in relationship to your daily activities. Very often I screen my patients through clenching behaviors or tensing of the jaw behaviors, and a couple of things that I do, I look into what's called scallop formations on your tongue. So the first thing I would do, ask my patients, stick your tongue out, and I will look in that section of the tongue on the sides, and what we see some waves on that, and it's pretty much just the imprinting of the tongue into your teeth inside. Okay, if you have the scallop formation, it tells me that the patient is tensing on the jaw or thrusting your tongue into the teeth. And also sometimes there is a ridge into the mucosa, the gum inside. There's a line inside. If you go with your tongue, that way you can feel a ridge. I usually put my finger with the gloves and then kind of check for that ridge. That is also telling me that there's a lot of sucking action with the muscles in here. So that amount of tension, it overwork also the jaw muscles. We describe in the PT world as a parafunctional activity of the jaw, because the only time your jaw muscles should be working is actually when you're chewing. Okay, and your teeth should never be touching one another, the top and the bottom, unless you're eating something. Okay, so number one thing that I tell my patients, put a timer and pay attention to what you're doing with your jaw and how much you're tensing up into that jaw. Okay, things to help you to break the pattern is to do some wiggles at the mouth. Very small motions, nothing big, and just kind of little motion like you'd like something like that, just kind of nice and fun. Another thing is that just say the letter no. If you look very closely, no, nuts. My tongue immediately comes to the front teeth, to the top, towards the roof of the mouth, and that's the relaxed position of the tongue. Okay, and it's also a nice way for you to monitor how much you're opening, because if you open your mouth and you keep your tongue on the roof, if you try to open wider, your tongue, it kind of sticks away from the roof of the mouth, so that kind of helps you to guide about excessive opening. So just the relaxed position is like that. Your lips should be gently parted, not pressing like that, gently parted, and your teeth should not doing that, just not touching unless you're chewing something. Okay, so that's the relaxed position of your jaw, and if you are not doing that, you're over tensing the masseters and the temporary muscles, which might be contributing to compression forces at the joint, creating joint pain, the TMJ, inner ear pain. It can even cause dizziness, fullness in the ear, ringing in the ear, headaches, neck pain, all because you are having this parafunctional activities at the jaw. Okay, so breaking the behavior during the day is when you're very conscious and putting the timer and doing wiggles, nose. If you need a massage with your knuckles, nice and gentle in any direction in here, Of course, you can use your fingers, but for my patients with hypermobility disorder, fingers can be very loosey-goosey. So I said use your knuckles and do some gentle circles. Anything that feels, oh yes, that's the right spot. And then scalp massages and here, kind of get to the temporalis. If you find any specific point that is very tender, that's the one to work in, okay? But in nighttime, it's kind of hard for you to pay attention what you're doing with your jaw, and because you're sleeping, right? You're subconscious, and one way to prevent, or at least to protect your joint and protect your teeth, is to wear a mouth guard, okay? Mouth guards are usually the best ones are the ones that are customized to you with the dentist. And I have issues with grinding, bruxism, and for the longest time, I tried the molded ones from the dentist. They put it like a big, almost like something like this. They put the putty in there and make you press it. They do the top impression, the bottom impression, and they send it to the lab, and they make one of them. They're not necessarily bad, but people that have issues with the jaw, and they have difficulty sleeping with a mouth guard in their mouth, sometimes they're not as well fitted as they should be or they could be. And I found it one dentist that does a 3D scanning. So it looks like a little pencil, and they go in and they scan how you close your mouth, and they scan the inside of your teeth, the outside of your teeth, and that has been by far the best mouth guard I have ever have. This is my most recent one. They look like a little acrylic. They almost look like Invisalign. The Invisalign is not enough thickness for to be working as a mouth guard. This one is a little bit thicker, and it fits perfectly in my mouth. It's difficult to speak with it, but if you're having issues monitoring your activities during the day, you might want to start wearing even during the day, and also wearing during the night as well. Okay, I'm going to put it mine on so you can see how well it fits. So I will speak funny when I have this because, like I said, it's very thick, okay? But it does keep my teeth apart, okay? And so you can understand me. That amount of space is crucial to maintain the joints slightly open, so there's not a lot of compression in the joint, and also will protect the teeth, because if you grind it, eventually you can crack a tooth, fracture all the way down to the root, which then will require more aggressive treatment, more invasive treatment to fix a broken tooth. Okay, so I know you're going to spend a lot of money. Okay, most insurances will pay for a mouth guard. And then as far as I know, there's a limitation how often you can have it I think mine, it was every 5 years. If you have to pay out of pocket, you will have to budget for it because it's not cheap, okay? It's about $500 if you pay out of pocket, but it's worth it, okay? And I love mine. This is my second one, and I did pay out of pocket, and it's unbelievable. And I'm happy as I was for the first time. First time I used my insurance, and I pay about $200, okay? So try to budget, make a payment plan with your dentist, but do get a mouth guard because it will make a big difference about how your jaw feels. My jaw feels a lot better. I feel like, yeah, I cannot even sleep without my mouth guard. I feel like something's missing because it fits so well, and I'm just very fortunate, okay? So it's very important. Posture, activities that you do in your behaviors that you do with your jaw, and how much you're chewing it, what kind of food you're chewing it. Things are very chewy, like a chewy meat or crunchy nuts. If you're having a lot of jaw pain, you need to stay away from that, okay? And of course, doing the famous chin tucks. Chin tuck is supposed to be very gentle. People tend to do like this, and it's not that much, okay? It's very like this, and let it go. This and let it go. It's a small motion. I'm going to turn sideways so you can see how's that. It's just pull back and let it go. Pull back and let it go. And then put like maybe a little pulling down here and let it go. Pull back. People tend to overdo it. They do like this, the double chin. It is in that direction, but it's not that much, okay? Because there's a lot of straining in here. It's very, very gentle and come back. Gentle and back. And if you feel very uncomfortable, do less, okay? Small motion. And make sure to stretch your neck. So neck to the side, down to this way. So you're kind of stretching the trapezius muscles and the levator scapulae. And there's other things you can do for your neck, of course. You know, in terms of posture, you need to make sure that you're strengthening your muscles to help you to stay in good posture, okay? So don't forget to check the other videos that I have for neck and pain and how to manage a little bit of the posture, decompress your spine and stretching and doing a lot of stabilization exercise for your core. So there's a lot of videos on this channel as well to help with that. Hopefully this video was informative and help you to understand things that you can do on a regular basis to help you with your jaw pain, how to monitor what you're doing during the day and nighttime, things that you can make a change, as well as how much opening you're doing with your jaw, clenching behaviors, all those things that we want to change it to help you maintain a good space into your jaw, decreases the compression forces into your jaw, as well as overactive muscles. I'm Dr. Adriana Potter. Thanks for watching my channel, and don't forget to subscribe and press the bell button for the future videos. Bye bye.